An inquisitive child, our son.
Yep, he traveled his whole life.
Trains, planes, automobiles, and ferries he went on. Key West, Yellowstone. He was nonverbal, so everything was by look, by feel, by touch. We had our own communication. He was Curious George because he had one word.
All right, hold on, almost.
It was a sentence.
All right, one more. Look at Dad. All right, put your arms down. Good boy.
Jack and Karen were more than parents. They were also providing 24/7 medical care.
Nonverbal, apraxia, that was part of it, that was the nonverbal. Moderate intellectual disability. Behavior disorders. He was also impulsive. It was a lot. And the seizures was, that was what triggered the severe behaviors.
At age 17, Austin was placed in 24/7 care at Laurel Heights Hospital.
Ever in your wildest fears did you think he could die at the facility?
Never.
Never.
It didn't cross our minds. Because he'd been safe with us. He'd been safe in my care. And I relinquished that care to trained professionals, and he died in a trained facility. That is not right on any level.
His parents say the details of Austin's death are unclear.
They said that Austin had an altercation with another student, and he choked.
We envisioned him eating lunch and choking on his food.
That was not accurate. There is more to the story.
The medical examiner lists Austin's death as a homicide, choking on his own vomit while being restrained.
How many other times has this happened? How many other parents?
Those questions set off our investigation. We followed the claims of abuse at Georgia's 10 facilities owned by Universal Health Services. UHS runs the hospital where Austin died, and it's one of the largest operators of mental health facilities in the state. Police reports reveal at least 64 claims. Most involve children or teens. Some are cases of physical harm. The others allege sexual abuse. Of all the cases, we only found 3 resulting in an employee arrest. UHS responded by saying, quote, "It is not accurate to impose a blanket characterization of abuse based upon a word or words written in a police report. We believe even one negative incident or experience is one too many." Our facilities fully cooperate with authorities in all cases.
I don't know where it went wrong. I don't know what I did wrong. But it happened so fast.
Police interviews recorded with the hospital staff explain the moments leading to Austin's death.
I'm just trying to, get him to calm down. I'm talking through it. Austin, you okay? You okay?
So he swung at me, and that's when he fell on the ground in front of me. So I jumped on top of him to hold his arms down. And then another male staff came to hold his feet.
I went to restrain him and hold him. We were trying to get him positioned correctly on his side. And once we got him there, so something's not right. So when we looked at him, he was purple.
In response to Austin's death, a hospital spokesperson sent us a statement. Austin Skidmore died in our care, and for that we are responsible. Laurel Heights Hospital cooperated fully with authorities in the investigation. No criminal charges were filed. We undertook a comprehensive assessment and instituted appropriate corrective actions to the satisfaction of regulatory authorities.
We're angry. We were under the assumption that it was something that Austin just happened to Austin. It didn't just happen to Austin.
We also uncovered 42 cases of alleged sexual abuse at UHS's Georgia facilities.
Why didn't you guys request an exam or call the police on Monday?
Police interviews with UHS hospital staffers reveal questions about how those claims are handled.
As far as police, we don't often involve the police.
I understand.
It's just not our standard practice.
Jeremy, from your findings, just how common is abuse at these facilities?
we identified 64 cases of abuse, and that actually may not represent the total number of incidents for a number of reasons. Notably, it can be very difficult to report abuse due to stigma and self-blame. That can deter a lot of teens from coming forward. We've posted our full investigation, Calling for Care, on 11alive.com. It documents another family's journey from discovering their son was abused by another patient to finding another source of care.